Dr. Ken Landau. Let's talk about Otezla. Otezla is the subject of slickly produced ads. It's a drug for psoriasis, and fortunately this drug can be taken orally. Question is it really worth it? Well, psoriasis, if you have moderate to severe disease, can be a condition that severely and negatively affects the quality of life. So you look for some kind of a treatment. So people look for Otezla, perhaps. It's an oral medicine, so that's kind of good. It seems to increase the anti-inflammatory substances your body produces and decrease the inflammatory body chemicals. We know that you have to start taking the pill at a very low dose, 10 milligrams a day, and you increase it over the course of a week to 30 milligrams twice a day. If you take too much of the pill too quickly, you're going to get abdominal problems. Question is, how's this drug stack up to all of the rest of the drugs you see advertised on the television? Well, after 16 weeks of taking it, the 75% improvement rate is only about a third, and the patients are rated as clear or completely clear only about 20% of the time, and that compares to, say, almost a 60% clearance with Humira, same sort of clearance with Remicade, and about a 35 to 40% clearance with Enbrel. Well, there's some significant side effects of taking Otezla. Otezla can cause depression and mood changes. It can cause suicidal ideations and even suicide. And in 1 person in 8, it's associated with significant weight loss of 5 to 10% of the original body weight. And in 2% of the people, it's associated with more than 10% weight loss. No explanation for why this occurs. It just occurs and can be significant, and it can be severe. And about 1 in 5 people or thereabouts suffers from diarrhea or nausea. And we know that there's a significant incidence of headache and abdominal pain, cough, insomnia, and vomiting. And we know that the pill contains a fair amount of lactose. So if you're lactose intolerant, you might have a problem with it. Well, there's certain pills you shouldn't take it with because they might interact. Pills like phenytoin, if you have epilepsy or certain other kind of conditions it's used for, or Tegretol for headache. How well does the pill work? Well, we said not very well. It seems that the National Institute for Health Care and Excellence, or NICE, that's part of the National Health Service in England, they evaluated the pill and they rejected its routine use. They said it's just too expensive. How expensive? Well, if you take this medication, if you take 1 pill twice a day for a month, the cost is going to be about $2,500. And if you take the pill every day, twice a day for a year, the cost is going to be about $36,000. Now compare that to another drug, a drug that's been around for a long time. It's not advertised, it's not one of those slickly marketed drugs, but it's just around. And the yearly price of methotrexate is $360 instead of $36,000. The company projects the sales are going to be somewhere between $1.5 billion to $2 billion, but since it doesn't seem to work very well, analysts suggest maybe only about $1 to $1.5 billion. Now you have to realize that these drugs are phenomenally profitable for the drug manufacturers. They're not very good for the insurance companies because they end up paying a fair amount of money. And the problem is that they raise your premiums. And remember, the $36,000 compared to $360 for the methotrexate. Do you really get all that much more benefit if you take Otezla? Well, if you look at the ads, the answer would be yes. If you look at the results, the answer is not so sure. Well, anyway, so now you know you have to be a little bit careful when you see some of these advertisements for drugs, for the fancy drugs, especially for the psoriasis drugs, because they're very expensive, they're very profitable to the drug manufacturers, but the question is there really all that much of a benefit compared to the older drugs? And the answer oftentimes is no. Anyway, thanks for watching. I'm Dr. Ken Landau.